Welcome to Dyno Care Pixar beta launch. We are excited. I'm Mohit Goel and from the team of Pixar welcoming you to be part of our beta launch. We are equally excited. We want to thank each and everybody of you who are present here and the people who are seeing us on the web. Thank you so much. You are making our day and thank you for being part of our journey. We want to keep this presentation and the launch as simple as possible and as crisp as possible. So not going through much of the time, we want to start off with a small introduction, a keynote address by our eminent guest, mobile app launch, website launch, and open session for question and answers. Of course, this journey had been started 7 months back, and this journey of Pixar would not have been started without the support of our T-Hub incubators, Mr. Suresh sir, Aarti, Mr. Mandhar, Mr. Shankar, Mr. Naveen, and not only this, our medical industry expert, our mentor, my mentor, Mr. Ashok Kapoor, Mr. Vinod Kapoor from Vishal Surgicals, my product development team, Gaurav Sharma, Prateek, Parth, Chaitanya, Ramesh, Samukti, and most importantly, the pillar of Pixar, our clinical mentors, Dr. Srinivas Kasha, Dr. Ranjit. I would like to welcome Dr. Srinivas. Let me introduce to Dr. Srinivas Kasha, who doesn't need any introduction. He is the Chief Consultant at KIMS Hospital, Secretary from Twin City Society.
Our experience need to be shared to other fellow orthopedic surgeons and to take it to the next level in research. So that will only happen if you secure your data. Data is, so in terms of orthopedic surgeons, it is taking X-rays of pre-operative, that is before treatment, and during treatment what kind of procedure we have done, and after the treatment how it has resulted because of the particular procedure. Let us say it is A procedure which has worked within very short time, within 6 weeks, and B kind of procedure which is in fact gave results in further short time. So that thing to be shared with other orthopedic community, and then only research will happen, and that will be useful for the humanity at large. And this particular thing, so I've been using various methods of storing my data for the last 10 years, I can say, and I just give you an example if I have time. Mohit, yeah. So initially I used to carry my photograph everywhere, camera, and take a photograph whenever some clinically significant thing is there, and dump everything into my computer. And later I used to sort it out. Every Wednesday I used to sit for about around 2 hours, leaving everything aside, and sort those things into particular folders. And so I did for about 4 to 5 years. In fact, during my post graduation time also I used to carry camera and do these things. One fine day my computer got crashed, and I started from zero again. So I don't have anything. So I have got presentations to be done that month, but I don't have any data. So I can't say these things. You can't go to the physical X-rays. Initially, my teachers used to have all these X-rays, kept it in one big room. So in fact, all the medical colleges and in person, also those who are interested, they used to keep in a particular library kind of a room in a sorted fashion. So I didn't even have that. So whatever data I had, so I have lost it. And from then onwards, I realized, no, these platforms won't work. And even after sorting this out, it's not working. So I wanted to choose a better platform, and I moved to Apple. So iOS. So because I'm not sure. I heard that this is more secure way of having the data stored. So, but you can't sort it out. You have got, I can show you in my mobile. I have got 35,000 photographs within 3 years. And these photographs, whenever I have to do some presentation, I have to go in, dig all the 35,000 photographs, and then come back, pick up one particular case, which usually takes more than 3 to 4 days. In fact, sometimes months also. And I keep sitting in my presentation room or in the conference hall, waiting for my juniors. Dr. Rohit is here. My juniors to send the final photograph or final follow-up picture. So they are, in fact, they are more tense because I'm already near the podium and they have to work up and bring up a follow-up. So this particular problem is such a why I am sharing you this experience means this is what exactly this Pixar is going to completely eradicate this problem. I can tell you how. So this and for the last 7 years when I met Ranjit, he worked at our place. And we have done very good academic programs which are very much popular across the nation. And we had a thought that at some point of time we have to put a full stop to this. So we have to have something in hand by which you should be able to get the information within your hands. So is that possible? So that's where although it is there in our minds, but we are not experts, and we need somebody who can guide and take it to the next level. So Arjuna can do things, but Krishna made the difference. That's where Mohit came. So so although we know what is to be done, how it is to be there. So, but planning, execution, everything, he, with the help of Gaurav, really did a tremendous job, I can tell you. So, I've seen, since yesterday I'm seeing it, and I'm really excited, and even yesterday night my wife was asking, what are you doing on the phone all this night? So, I was really excited and wanted to do, pick up the things and take it to the next level. And I'm sure it is going to be a very big success, not only in India but beyond the borders. So I have that confidence. I must thank Ranjit, Mohit, and Gaurav, and for giving me this opportunity. And of course, T-Hub people who were behind, the success of this particular event. And thank you all.
Thank you so much, sir. That was so kind of you. Of course, you are God to us in providing us with all your clinical expertise, knowledge. When we started, we thought it would be a very small journey, but looking at those diagnoses, looking at 30,000 diagnoses in orthopedic itself, it's a huge task and it's a huge credit we have to give, and that's a huge respect to you. Looking at 30,000 diagnoses, remembering those 30,000 diagnoses is a difficult task. The other mentor, I would like to ask Dr. Ranjit, who has been supportive enough in helping us throughout the complete journey. I would introduce Dr. Ranjit to come over into the dais. Of course, Dr. Ranjit is a senior orthopedic surgeon at ESI Medical College.
First of all, I just wanted to say to Kasha sir, so you must be so thankful to madam for letting you work all the day to gather all your gallery. But from now on, madam will be thankful to Pixart. Same way, for me at my home, not just my wife, my son would also be happy because he will not see any more x-rays and intraoperative pictures in my gallery. He is just a 6-year-old kid who goes through my gallery and says, what are all these? He knows what is an x-ray and MRI because of my gallery. So as well, Anchal would be happy because Mohit must have understood half the orthopedics. He worked on 30,000 diagnoses till today. He knows what is clavicle. He was getting some clavicle x-ray from his cousin and he says that there's a clavicle fracture. He is understanding more than us. I'm sure even the team of Gaurav, Pratik and Path, everyone must have understood everything of orthopedics. So you please don't be competitors to us, okay? You just remain in your fields. We are enough people here. So, Team Pixart welcomes you all. I am very happy to be part of this team along with the technical side of Gaurav and Mohit, without which we couldn't have been at this place. Also, the journey started years ago, but it came into momentum months ago. But today is the day. It's very exciting for us. And as Dr. Kasha has told you, last night was very exciting to see the baby product in our hands, virtually in our hands, experimenting, experiencing everything together. We hope it would continue the same experience for all the users with all the vision and with all the mentorship of great people around us, helping us to make it a beautiful product. Thank you.
Of course, now we have heard from our clinical mentors, and to sum up with, we have come up with the main issue what we are addressing today is the data issue. Now, if I have to say from the saying, it has been said data that sit unused are no different from data that were never collected in the first place. Keeping that as part of our company's vision and mission, and somehow if we have to relate it, I'll start relating it. Number of cases number of COVID cases today, number of COVID cases 2 weeks back, that is data. PP kit manufacturers today, PP kit manufacturers pre-COVID, data. Clinical outcome today, clinical outcome in the past, in the future, it's data. Diagnosis treatment today, diagnosis treatment tomorrow, it's all data. Your phone gallery has got multiple number of pictures, as you have said, 30,000 pictures. Sir has got multiple pictures. I have got multiple pictures. How do I sort that data? How do I store that data? How do I collect that data? There is what we are talking today as an individual, as a profession, it's all about the data. What we are trying to do is, we have spoken to 1,000 odd doctors and tried to understand what our project is. Some doctors said we are trying creating a clinical database. Some doctors said we are trying creating a patient record management. Some doctors said we are trying sorting and organizing the data. Some doctors said we are helping them with the diagnosis and prognosis. Some doctors said we are helping them for the data storage and recovery. We were even surprised to know some doctors said we are actually creating a super specialized EMR. Some said we are helping them with the mobile app creation. Somebody said we are helping them with a website solution. Yes, 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 yes. We are doing everything. We are doing all of the above. But apart from all this thing, we are actually creating a platform for doctors to help them overcome their day-to-day challenges, to ease and enhance their professional career. Welcome to the family of Pixot. I would like to welcome you all to the family of Pixot. We have along with us, of course, Dr. Bhamre could not join us in person, but we have in person, over the web, Dr. Bhamre. He has taken out some personal time for us to motivate and to talk something about Pixot. Dr. Bhamre is from D.Y. Patil, Pune. He further needs no introduction in the field of orthopedics. He has been a sports medicine. He has represented Commonwealth 2008. He is part of Khelo India Khelo as a nodal officer. I would request Dr. Bhamre to present yourself and give us some learnings.
Well, I realize if you see the Indian doctors, the surgeon or whether they're medical doctors, honestly, the amount of work they do, the clinical work or the surgeries is phenomenal. The volumes is huge, the numbers are huge, and they have a huge experience. They're hardworking, they're intelligent, they're well educated, they're well spoken, they have an excellent command over the language, the international language English. They're very good at written and spoken English. And in spite of all this, in spite of having all these assets, why Indian doctors aren't really doing very good in research and publication? Now I'm talking this because I worked in the Western world. I worked with the UK NHS and I've done fellowships in Australia, Singapore, Italy, and so many other places. I worked in India as well. So I could see the difference between these two countries as to, in spite of the Indian doctors being super brilliant, because the NHS has been run by Indian doctors, Silicon Valley is run by Indians, the NASA as such, if you say, is doing great because the Indian brain is there. So in spite of all this, why a new technique is not being devised? Why a new implant? Why a new equipment is not coming from India? Why there are not research papers coming from India? Why there are no publications in peer-reviewed journals from India? There are very few. And what is this? In spite of the volumes, as you see, I was working in the Western world and they have, say, for example, 25 cases and they publish in peer-reviewed journal. While our surgeon does 100 cases at one individual level. But yet this is not published. So why are we lacking in research and publications? And one has to find the reasons why this is happening so. Of the many reasons, I think one is the time constraint, which I often hear from my colleagues. Yes, we are busy, we are seeing a lot of patients in the Western world, but mind you, this is not the real reason, honestly, because if you are passionate about something, we definitely find time. So, I don't have time is, I think, not a great reason. I think what matters is we are lacking the awareness about the importance of research and publication. And I think that is where the younger surgeons need to be motivated, need to be made aware about. We lack motivation. And unfortunately, to this surprise, not all the doctors are techno-savvy, and most of them are not even aware what is a systematic review, what is the level of evidence, how to publish, which are the peer-reviewed journals, what are their factors, and so many other things people are not even aware. And unfortunately, we also lack the technology. As the previous doctors and honorable doctors mentioned, we had to, take it from our camera, the digital camera we used to carry in the pocket here, in a pouch, and then we used to take pictures and transfer it to the computer, and then, save it and print it whenever we need it. I think the technology was also missing. When I was working in Singapore, I was in Thailand as well, I've seen the underdeveloped and the developing countries and the Western world, and they had a wonderful system there. Everything was online, everything was on the cloud. And I think that made a difference. Why there are a lot of literature, why there is a lot of research coming from the Western world, and even small countries like Singapore and Thailand and Korea and China has taken the storm of the world of publications. So, as rightly said by Mohit, I think data, unless it is combined systematically, doesn't transform into information. And when the information is, there is a conclusion driven from that information, the knowledge comes in, and when you practice this knowledge, get experience, I think that becomes wisdom. So data as such has no implication. There's data scattered all over. We need data to be accumulated, to be collected, it has to be segregated, and we need a retrieval system, and then only can we use it. So when I saw this big thoughts, Mohit when he introduced me, he spoke to me a couple of times before also, and when I went through all this, got a little information about this, I'm really impressed. And the most important thing why is because it is absolutely secure. What matters is the data of the patients has to be secure, has to be confidentially stored, because it is medically very important. It is ethically very important. Leakage of data of the patient who is, say, even an average person, forget the VIPs and forget the actors and the stars, leaking into the press means you are doomed for OTs. So the data of the patients to be secure in a confidential way we need something called as HIPAA regulations, that is the Health Insurance Portability and Portability Act. And this is HIPAA compliant, and I'm very, very glad this is the most important thing of any app that is related to the medical sciences. So the good thing is we can segregate the data, we can retrieve it again, we can use it again, say for research, for publications, for presentations, for education of the junior surgeons. And I'm glad we can segregate the data by the name of the patient, the date of birth, the diagnosis, in the pictorial form, by the date. And well, various other means you can retrieve the data. Even if you don't remember the name of the patient, you remember the hospital name, you can go, oh, I operated this patient in, say Mumbai Hospital, or Bombay Hospital, or Pune Hospital, and I know, and I can go and retrieve. So I'm glad that this segregation of data has come in, and this definitely is going to make the job of the surgeons easy. They will motivate him to collect the data, store them, retrieve them, and use it further. The best part again is the lot of events that are seen and the newsletter which is coming from worldwide. And Mohit has promised me that very soon they're going to have a video uploading facility as well. So we do a lot of video recording of the surgeries, some new procedures or a better procedure, or for teaching purposes. And I'm pretty sure this particular app is going to make a huge difference in our lives, in day-to-day our lives, and it's going to make it easy for us, for the patients, and the services we are offering in India. I'm really grateful to the Pixel team, and I congratulate all of them again. Thank you indeed. Thank you.
Thank you so much, sir. As a bonus offer, not only video, we'll even try integrating the audio also, so that you can take consent.
Oh, brilliant, brilliant. Thank you.
We won't leave you now, sir. We want you to actually inaugurate our website.
Oh, that's really. Thank you. Yeah, so should I go on Google and just.
You could present your screen, sir, which we can.
Sure. Yeah, right. So present now a window. Right. Okay. Can you see my screen now? What?
1 second, sir.
Can you see my screen?
1 second, sir.
Sure.
Yes, sir. We can see it.
Yeah. Okay. Can you see the Google?
Yes, sir.
Yeah. My screen now?
Yes.
Okay. So let's inaugurate. So yeah. So again, congratulations to all of you. Wow, that's brilliant. That's brilliant. I hope everyone can see this wonderful website here. And here you go, pixel.com and hello@pixel.com, and you can see a download facility here. Of course, Mohit is going to tell us more about this. But there you go, the whole website, or the pictorial form, which I just loved. And as you rightly said, there you go, expert opinion coming from Dr. Ranjit and Dr. Kasha.
And yes, you also, sir.
Offering here as well. Right, great. I'm really glad. Thank you, all of you. Thank you.
When initially when Mohit discussed with me about this thing before lockdown days, everybody was free. I was also thinking that it's such a simple thing, and I was also, my opinion was, things. My always thinking is that things have to be very complicated to be solved. But I never realized that such a thing which is like a sorting of images and there was no solution so far available for this. And again, I was a little hesitant. I used to think in a different way that I never thought that it is such a big problem. And then slowly, when Mohit showed me the app of recently, I was completely at wow of it, that what you guys have achieved. I mean, I have seen all of you. I've discussed with Gaurav sir and Ranjit sir. I've seen them. I mean, it's something which is really amazing, and I really wish the best of luck for. And I'm sure this product is going to be not only be used in India. I'm 100% sure this is a need which is there everywhere. Not only, and this is just a very beginning of a problem solution which you have found, and I'm sure there are many more things which needs to be still achieved and will be achieved. Thank you all, and congratulations, Mohit.
I would like to request Dr. Pavani madam, Dr. Sirisha madam to launch our app. We want to push our app to all our beta users.
this app would be available to our 50 beta users today, so that they can advise us, they can critically give us the views how this app is functioning, so that we can fix it for much better. Please, Dr. Pavni madam, Dr. Sirisha madam, please.
Dr. Rohit, I work in Dr. Srinivas Kashas's team in Tim's Hospital. As a surgeon, my first doubt when someone asks me to upload any photos in an app or online is, what is the safety I'm getting? What kind of safety can the person who's asking me to upload, or the app, the app makers and all can give me? What kind of safety can you give us? Data safety, yeah.
So, I'm sure that Dr. Pamre already answered this question, but again I will answer this question. We are incorporating HIPAA compliances. It's a very international standard protocols which you have to follow for storing any kind of medical records. So once HIPAA compliances are integrated, your data is absolutely secure. No worry about it. It's like you are depositing your money in RBI, and no money heist can happen there.
Not much aware of the terminology, but yeah, I think they're in safe hands.
Rohit, I completely agree your question. We as a clinical team made sure to the technical team that this is going to be the first safety feature. So like WhatsApp creates some encryption, data encryption, which cannot be read by third person. The data is so secure that even the admin, the team Pixar, cannot peek into your user login and try to see how many data are.
Excellent.
So this particular database is unique for each individual surgeon, and it is limited to your cloud setting.
Okay.
So it's not like any other thing. So it is almost like your cloud. The only differentiating feature of this app is it has got a picture sorting ability with respect to the diagnosis, which can make you filter and retrieve your data as and when required at your fingertips. The security and the safety is as per regular norms of iCloud or anything. It's a cloud based, but no one can peek into your data, or no one can tweak into your data.
So that's my first doubt when someone asks me to share the photos or upload the photos, whether it is Facebook or Insta or anything. So we all have our own privacy. Especially this is the clinical data concerning the patient. So it's even more priority than our personal photos. So that's one of the first doubts that has come to my mind.
I agree with you, Rohit. It's not only for security reasons, but also medical legal purposes. We have to be very careful, and our team has made sure that it is very much secure in terms of safety, and all points are taken into consideration even during exporting of the images to storing of the images. And
I'm sorry to interrupt you, sir. I think you should watch the picture. We are not going to release everything today. This is just a trailer. You should watch the picture. Then you should give us a review.
Sure, definitely. I'm going to do that.
But the point he made is it's there in everybody's mind. It's not just Rohit. It's the orthopedic surgeon who is going to use it. The first question he gets is this.
That's the only doubt I had.
Do we have any other questions from the people who are sitting in the room? If you don't have, I have many questions. Today is my turn. Okay. So my first question goes to Dr. Ranjit. Dr. Ranjit, there are like kind of more than 3,000 annotations. You have another question? Question coming from the audience? Sure. That will make my job a little easier. Okay. Where is the question?
Someone's trying to say it's a comment.
Okay.
Please comment your questions here.
If you can hear me, then you can write your question and then we can take it from here. Sure. So my question was for you, Dr. Ranjit. Since as you told that I have become a self-certified orthopedician surgeon, that diagnosis, right, that annotations, it takes huge amount of effort, right? How much time, how much sleepless night you had to create that data? Yeah, that annotations, whatever that beautifully we have been trying to put it. How much sleepless night you have spent over there?
So I've taught I've shown him the technique and he has taught me the Excel.
Okay, then you are saying that I should ask this question to Mohit. Okay, over to you. How many months here?
I think this would have taken me approximately about 5 to 6 months to actually gather all this data. And if I have to calculate a number of nights I have disturbed Dr. Ranjit sir during his COVID time, being in under isolation, I think he has given the maximum amount of time, whether it was 2 a.m. call, whether it was 3 a.m. call, whether it was early morning 7 a.m. call, he was always open for any kind of input. And similarly, that is the freedom we are even enjoying with Dr. Srinivas Kasha sir also. I slept last night 1 o'clock, woke up at 4 o'clock. Srinivasa Kasha sir has had some doubt today. This morning 4 o'clock, I had to answer that doubt today.
Gaurav, the best answer for
Okay.
the answer to your question is when Rajat has told that the problem looks simple, why are these guys making it big? The annotations will make him understand that the problem is so complex. So we are actually into his vision. We are actually into his vision. We are actually simplifying a complex annotations into a simplified database storage system.
What I could even suggest is, see, we have done it on the Excel sheet. To put down on the solution, the majority of work has been done by you. Now you have to tell me the figure of 30,000 diagnosis. I have not figured it out. You were the one who actually figured out it's 30,000 diagnosis, and I have spent all my days and nights putting it on to a solution.
Okay, now the question which I asked, I only need to answer. Okay, it's fine. So I'll say that like after all the hard work which you guys did, it took 90 days effort of one single person to complete that. And like after that there were so many revisions, so it was my effort and then rest of was your effort. So I'll move to the next question. Do you have any question? Okay. So there's one question that I'm having. Are we only targeting any specific domain of the doctors for this application, or is it targeted to other way around for other specialists and all? Question to you, Mohit, and like.
Start off with, we are actually targeting the orthopedic surgeon. First, we want to get the complete thing on the orthopedic surgeon, then we would be moving to multiple specialities. So, yes, we are starting off with the orthopedic surgeon as of now.
So futuristically, we can say that we are also coming with the other specialized and specialties.
The whole medical community.
The whole community.
We started off with a vision of India. Sir has given us a vision of Southeast Asia. Let us see. And beyond.
Wow. That's good. It's not just a simple app, it's a platform, I would say. But if I speak more here, Mohit is definitely going to kill me. Why you are revealing everything today only? You have to have this kind of sessions again and again, right? So to answer your question, yes, definitely for futuristic things, we have lots of feature planned which will be coming soon. I'm sure the team is working very hard to get these things done, and hopefully very soon you will see all those kind of things. Sure. Thanks, guys. Then I think any other questions from anyone, please?
How is medical data currently being managed? honestly speaking, there is no such a foolproof system or this works good kind of thing is not there yet. So, and orthopedic is something where it's all immediate. Even if you have a leg pain or a neck pain, you must go to a doctor and ask him to get an X-ray. Nowadays, so even if we want to write medication, no, no, sir, see, karo. So that is the thing. So you want to see everything. Like visibility is the main thing in orthopedics. So the visibility guides in treatment also. So if you get an X-ray done for your neck, where a patient comes with a pain, so we see something there and then treat further. So similarly, before surgery and during surgery and after surgery, these are the three major things. And in order to know the procedure which you have done is benefiting them in comparison with the previous procedures, is it good or bad? So we need to see. That visibility is there with the X-ray. That is better in the prostate surgery. If you take any other specialty, so you operate and you don't see it again. But we see every 6 weeks. Right? So, and we follow up till the patient or the patient gets back to his previous normal working level. And this data, so far, whatever data that is procuring methods that are available, there is no specific method. And like Dr. Gumre told, even in the Western world, so the hospitals invest a lot of money in having a software where they store images, but that is only in the hospital. So if you go beyond the hospital, say if I am working in Teams, if I left the hospital and working in another hospital for maybe after 2 to 3 years, I cannot get the data of the previous hospital, right? That is the issue in India. So you don't have a proper method, and this is the tool. In fact, so this is the probably like doctor said. So we are not getting as many publications in terms of research in orthopedics, not only orthopedics, medical side when compared to other part of the world. So this is probably the step forward, and this gives you data which is already with us, and it is putting onto the paper and publishing is the next task. So once you have the data procured, so you can think of doing some research and taking to the next level. So all the methods which are there are proved, and no specific method till date as far as to my knowledge. What do you say, Ranjit?
Just to simplify your answer, when we actually visited and had an interactive session to them discussing about this technology and discussing the prospects of this particular app, the first question from the mentor of the rehab was, how different are you from EMR, electronic medical records? The one answer straightforward to this question is, this is a macro representation of an EMR. A EMR would take its own time to fill up each case sheet. In US, or any particular physician would not attend more than 10 new cases per day. It's because he takes in at least an hour for each patient because he has to fill in all the details. Pixart has made sure that it only incorporates the essential data, record keeping in mind the time and factors for an individual orthopedic surgeon at the fingertips, so that the retrieval is also at the fingertips. We are not actually looking to replace the medical records. We are only trying to simplify the doctor's life in terms of having research background and database, as well as for his own medical legal purpose, as well as his own mobile packs. As sir was telling, today I might be in this hospital, tomorrow I might change the hospital, but the other hospital will not give me their own packs. So it's an individual packs or the customized macro EMR equivalent to our Pixart.
And you also connected to your patient. Yes. And another important thing which we made is medical legal. So even for medical legal aspects, so once you leave a particular hospital and like, so there are so many people across India. The practice pattern in India is quite different from the rest of the world.
So one doctor operates at various hospitals. So you can't have all the data. So but you are the surgeon. So that's how the problem is sometimes if the patient is very poor, we might be operating in a very small nursing home, right? Where we can't think of a tax system or a system of having their own data. But here it is very handy in your pocket. Just to take it out and take a picture. You can even record the conversation with the patient for further medical legal purposes.
Uh, just a tricky question from my end to both the doctors. So when we are collecting such huge amount of data as you guys told, is there any form or chances that you are trying to remove some of the steps in the process of the medical treatments like MLAI maybe in the futuristic terms? Is that your vision in the next coming year with the app?
Any research is for the betterment in treatment. So if we COVID treatment like Mohit told, so if you compare to the previous, if you compare to probably March or April to today, it's completely different. Within 2 months, huge change. The outcomes are also changed. The way of treatment is changed. Such a drastic change is happening within 2 months. But that is based on data. It's not just with the circumstances of the treating people. So they have data. So if somebody has done, if some doctor is treating with a particular method at some hospital and he has got good outcomes, that will be published and rest of the people will follow. That's what is research. Whenever we are talking about publication and evidence, so that's what is about research. And that in the future, if particular procedure is working well, so that will become a treatment norm in the future. Similarly, this is a tool by which it helps in doing some research for a day-to-day practice.
Thank you. That answers my questions a bit. Thank you.
Thank you.
I guess we have these many questions. We found it on the chat. Thank you for all of your precious time. Over to Mohit sir.
Thank you everybody for giving your valuable and precious time today. This app would be available to 50 beta users of ours and it should be immediately, it's already released and you can get the link on your personal email which you have registered. Kindly go through this app, give us your feedback. Your feedback is equally important for us for the betterment of this app. Very soon, next couple of weeks, we should be having a web version of this and various other solutions. As Dr. Bhamre sir, we would be even having the voice, the video also integrated. Next couple of weeks. Thank you so much. Thank you so much for your time, Dr. Bhamre sir. Thank you so much, Dr. Ranjit sir. Thank you so much, Dr. Kasha sir, and all our esteemed guests who have joined us. Thank you so much.